let's look at another NCLEX tip. This is going to be your NCLEX tip number 3. And what we're going to talk about in this tip is Pheochromocytoma. So this is going to be our tip number 3 in our NCLEX tip series here in my YouTube. Okay, so let's start. Okay, so how are you? How's everybody? Wherever you are, good morning, good afternoon, good evening, whenever you're watching this. So the condition that we're going to be looking at is pheochromocytoma. So this is a tumor. So this is a tumor of the adrenal medulla that produces excessive catecholamine release, specifically norepi and epinephrine, which can cause really massive sympathetic stimulation. So it's really massive. So these hormones, these two hormones, this one and this one, so epi and norepi. So these hormones, let me put it at the middle, actually activates alpha as well as beta receptors. Just think about it. When it activates it and it's a sympathetic discharge, you're going to have very severe sympathetic stimulation. So what NCLEX is going to show in their STEM, in the question STEM, is the classic triad that comes with pheochromocytoma. Okay, and the classic triads include headache, sweating, and tachycardia. Together with that, the patient develops severe and persistent hypertension. It's really severe, it's really high, and it's persistent hypertension. It's usually due to the vasoconstricting effect, specifically on the alpha-1. So let's put alpha-1 receptors. So here's an important management rule that the students need to know when they're taking their NCLEX exam. And I'm going to highlight that over here. The important management rule is, you write it down. So the important management rule is when treating this condition, alpha blockers should be given before beta blockers to prevent unopposed alpha stimulation. So let me explain. So the medication, which is specific for pheochromocytoma, and it's an alpha blocker, is called phenoxybenzamine. That's the alpha blocker that is commonly used in pheochromocytoma, and it has to be given before a beta blocker. So let's say a beta blocker such as propranolol, right? And why is that? Because if you give beta blocker first, if you give this first, if you gave a beta blocker first, you remove the beta-mediated vasodilation because it's, a beta blocker, but you leave an unopposed alpha stimulation, which can cause very dangerous hypertension. Okay? So, but another thing to think about for pheochromocytoma, because I'm 100% sure this is what's going to come out in your exam, is do not palpate the abdomen. And the reason is because manipulation can trigger the release of this catecholamine surge, meaning to say it can go all over the place and can cause massive hypertensive crisis. So remember this. Adrenal tumor, when we talk about pheochromocytoma, right? and the adrenal tumor is in the medulla. So if they want to be very specific, it's in the adrenal medulla, not in the adrenal cortex. It causes severe, very high hypertension, and the medication is alpha blocker first. So in this scenario, phenoxybenzaimine first before a beta blocker, which is a propranolol. I'm just giving an example. So this is our tip number 3 for our NCLEX tip. So if you're taking the NCLEX soon, you need to watch this video. Thank you for watching.